Let's practice some E&M coding. Okay, so we're going to say that this is an established patient, and this is for a dermatology visit. The documentation looks complete, so we're going to go with that. We have the patient's demographics, the chief complaint. The patient presents with worsening rash, with severe itching and redness, progressively spreading over the past 2 weeks. Take a look at this note. There is an HPI documented. There is a past medical history documented. There are vital signs documented. The provider assessed the patient with a primary diagnosis of eczema with secondary bacterial infection. The provider also noted that there was suspected secondary infection due to the excoriations and weeping lesions. And then they also confirmed a diagnosis of history of seasonal allergies, which was also noted in the past medical history. The provider's plan is to perform diagnostic testing. So they ordered a culture swab from the affected area to rule out the secondary infection that's suspected. They also prescribe a few medications, and you can take a look at the note and look at the number of medications that was prescribed. The doctor also provided follow-up education, avoid scratching the area, apply a cold compress to relieve itching, use mild soaps, fragrance-free detergents, follow up within 7 days, and instructs the patient to seek urgent care if symptoms worsen, fever develops, or they have increased weeping and crusting. Now, pause the video so that you can take a look at this note completely so that you can come up with your answer. My question to you: what E&M level would you give this encounter? Again, we're going to say that the patient is established to this dermatologist. The dermatologist knows this patient and have seen this patient within the last 3 years. So that's your hint for which section of the CPT book, E&M section, you should look into. But go ahead and level this section, this encounter, and put your response in the comments. If you have trouble leveling E&M, I do have a free E&M leveling tool in my bio. You feel free to go ahead and download that and utilize that in helping you to level out this encounter. And if you like these types of posts, let me know in the comments and I'll be sure to add this to my content.